Welcome back to Healthy Living. We're talking today about comprehensive breast health. We heard from Cindy Turner, who is a nurse navigator with St. Tammany Health System, and we're talking next with Melissa Varnado, who is a nurse practitioner in the high-risk breast disease clinic of St. Tammany Health System. Melissa, welcome to the show.
I'm so happy to be here.
We're really excited you're here. And the high-risk breast disease clinic is really a unique aspect that St. Tammany Health System introduced a few years ago. And when you think about that continuum, Cindy and I were talking early detection, we were talking about some of the diagnostic tools at the Women's Pavilion. But there are so many decisions that need to be made and so much that breast cancer patients have to consider and sort out and move forward. And you as a nurse practitioner in the high-risk clinic really have a role to help people through that.
And I love that role. It's a good catch-all. It is once they have a screening mammogram that goes to diagnostic, sometimes they have some questions. I'm able, they can reach me as they can reach Miss Cindy. And it's we're a touch point for them. And then we kind of work through the diagnosis, and as soon as we know it's cancer, we get them in the clinic within a day or two, and we meet with Dr. Bonagera, we get a plan, we reach out to a medical oncologist, radiation oncologist, and everybody gets together. We have multi-disciplinary meetings where everybody sits at the table and we all have a group discussion and get a plan what's best for our patients. So it is a piece of a larger puzzle, but it's the best specialists for our patients. They get the care that they need.
That's fascinating. And to me, you said multidisciplinary, and that is something that I think really makes that high-risk clinic and our entire system not unique, because obviously multidisciplinary teams are the future of cancer care, but it's right here in Covington.
It is.
And that multidisciplinary approach that you're talking about, you have those diagnostic perspectives from radiology, and you have those curative modalities. So you're hearing from someone who knows chemotherapy, and someone who knows radiation, and someone who knows surgery. And so each of those are looking at cases. And the other thing that I wanted you to talk about, it's not that they're talking in general about a case or cases, they're talking about this patient.
Absolutely. It's
and
individualized
these exams. So kind of walk through that.
So the perfect, it's just a kind of a perfect storm. We got the best in every field. We get together, we talk about individualized care, and we're able to deliver it the St. Tammany way, at the bedside, at the clinic. We are your friends, we're your family, we see you in the grocery store. So you have the access to all these specialists that are renowned in their field, but the delivery is hometown. You know, you're not a part of a larger system, you're just a part of the family, and we'll take care of you. And even years after your diagnosis, when it's just a part of your medical history, we still take care of you, we still follow you. So you never leave us. So from, as I said, from diagnosis to care delivery to survivorship, we're here for you.
That's wonderful. I'm just envisioning that, because you think about as a healthy person who, let's go ahead and admit, I'm north of 50. So yes, I get my mammograms.
Good.
And I go to the Women's Pavilion because I love that spa.
Yes.
And each year I just go and I think, all right, I just need to get this done, and I'm done. But there is that moment, there is that time that a patient can have that callback. So I'm checking my chart and it says, yep, everything's fine.
Yes.
But I could be checking my chart and get, everything's not fine and we need to talk to you.
And the good news is, at the Women's Pavilion, usually you don't get the report on your screen. You get it face to face. This is what we have. This is what we think we have. This is what we have to do about it. This is our plan. So it's not the, but what if? And you don't go through this process alone at all. It is definitely physician guided care. It is, I'm here, the breast nurses are here. You always have an access to the clinic. You always have access to your provider, which is wonderful. But you don't have that diagnosis. It's not alone. It's not technical. It is personalized care.
I love that. You know, I was talking about my chart, and I love my chart
It's
because
very good,
it's
right.
so useful.
Yes.
As a matter of fact, the newest thing in breast care in my chart is that you can schedule your own screening mammogram.
Yes.
Which I'm just thrilled about, because it's nice to call the Women's Pavilion when they're open, talk with someone, get it set up. But if they're not
ease
open,
of access, right?
If it's 10 o'clock at night when I go, oh, I didn't call today.
Yeah, but it's fine. We're here.
That's perfect.
And we have a great event in October. So it doesn't have to be because it always is. It's I have to go do this, because let's face it, nobody looks forward to their mammogram, and there's a lot of anxiety there. But in October we have a wonderful party, and we had food trucks, we had champagne, and it made it a pleasant experience with the Be Well bus. So it's an event you look forward to, especially because October is our Breast Cancer Awareness Month. So the Women's Pavilion is very, very, motivated to make it a positive experience, and for something we don't dread every year, because it is so very important, especially for the women that have mothers that have breast cancer, aunts that have breast cancer, because that makes them higher risk. And that's why I'm there. We discuss the risk. Is it their family risk? Is it their genetic risk? And do they just have a breast density risk? If you're higher in breast density, then it automatically makes you a higher risk for breast cancer. So we kind of go through the factors that make them high risk. What do we do about it? Do we do surveillance? Do we talk about risk-reducing mastectomies? There's lots of options there. And I tell everybody, my job is just not to make the decision for you, to make you the most educated, give you the most education so you can be a good advocate for your own healthcare, and that will make you strong to make your own decision. So it's just giving them the information, letting them make the decision that's best for you and your family.
I'm just trying to process all those things. That's amazing. So in the high-risk clinic, you're just talking about what makes a patient high risk.
Correct.
And so, I think that we generally hear about people who have a genetic predisposition toward cancer. So if your mom had breast cancer, and her sister, your aunt, had breast cancer, and their mother, your grandmother, had breast cancer, that's enough that you're kind of at high risk.
Right.
And so maybe there are more surveillance tools.
Certainly.
Or maybe we want to be much better about those screening mammograms.
Yes. And twice a year would be ideal if you're indeed high risk. But we're very good at having our GYNs and our family practice doctors or physicians or mid-levels see, once they get those yearly mammograms, if they do a scoring at the bottom, if they consider their score high, to refer to us. So my first question is, when our ladies sit down, or our men sit down and say, do you know why you have this appointment? And then we'll go through everything, all the factors that kind of made them a higher risk patient. And then knowing their number, what are we going to do about it? Are we going to do twice a year screenings? And it's just kind of it's preventative medicine. And if your risk factor is high enough, do we need to talk about risk-reducing mastectomies? So if 100 women walk in and they all have breast cancer, 10 of them have it because it's genetics. A lot of people think it's genetics is the larger part. It's not, because Angelina Jolie, her mama had the breast cancer mutation. She had the mutation. That's why she had her risk-reducing mastectomies. So that got a lot of information out in the public. But so everybody thinks that it's all genetic, but it's not. It's just a tiny part. 10 to 20% of those women have familiar cancers, like you were talking about. The aunt, the mom, the grandmother. But they didn't have a genetic link. It's still familiar. And then 70 to 80%, which is the scary part, is sporadic.
Wow.
So these are the ladies that had their screen and mammo, like you do every year, and got a call back, or got to have a sit down and said, hey, look, there's something we're concerned about. So that's why it's so important, because genetics is a piece of the puzzle, but it's certainly not the complete picture.
Right. And so if we're someone whose mom, aunt, grandma didn't have it, we don't want to just go, I'm in the clear.
Right.
We still want to have that screening every year.
Absolutely.
And we want to come back, and if we wind up at the high-risk breast clinic, we'll be meeting Melissa Varnado.
Yes, you will. But we try to the whole visit is to reduce anxiety, and we have such great tools. We have Dr. Torwick at Ochsner, and he helps with our patients with anxiety. So we have the Cancer Center, the St. Tammany Ochsner Cancer Center, that has integrative oncology there. So we have lots of good resources there to reduce some of the fear, some of the anxiety.
Fantastic. Well, Melissa, thank you so much for coming in to talk to us. I really learned a lot today, and I think our viewers did too.
Thank you for having me.
You're watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we're talking today about comprehensive breast health. We'll be right back.